This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, you got 20 minutes.
Perfect. Again, so thanks for everyone taking your time to log on to this. I found it very helpful when I was a medical student applying. I think it's nice for you guys to kind of host this event. So thanks for PM&R Scholars for hosting. Again, I'm Ricky. I'm one of the chief residents at Burke. So a little bit about us. I'll let Isaac start us off.
What's going on, everyone? Yeah, as mentioned, my name is Isaac, one of the new PGY2s here at Burke. I'll start us off with a little bit of history here. Burke was founded in 1915 and grew from there into what it is now. Residency program is fairly new, I guess you could say, 2016. But you wouldn't really, you don't really get that vibe from the experience and everything we have there. 150 bed standalone rehab hospital. With cardiopulm, ortho amp, SCI, TBI, and stroke units, each with 30 beds each. And we have neuropsychology, internal medicine, music therapy, canine therapy, rec therapy, and a bunch of other kinds of inpatient services to offer for our patients, which is really a big help and nice to have on hand.
Next slide. I was like showing this picture because our campus is very beautiful.
Campus is great. Campus is really nice looking. You get there first day and you're like, oh, this is pretty. So White Plains itself, talking about that a little bit. I'm not from the area here, so coming from Florida was definitely a change, but a good change. It's pretty suburban, 11th largest city in New York. There's a big mall, nice downtown city center area with a bunch of bars and restaurants, things like that to do. A lot of outdoor activities if you're into that, golfing, a lot of parks nearby, only like a 30-minute drive to the city. There's a train station right here in White Plains, 40 minutes direct to Grand Central, right in the heart of New York City. So that's also very nice, very convenient to go there. So yeah, basically, like any other suburban city, a lot of things to do, very fun, younger, nice young population too nearby. It's a mix, pretty nice area. Next slide. Wellness, everybody talks about wellness, obviously, but definitely important, especially in residency. So far, I've been here for a month and we've already had, a couple of events. We just had a barbecue today, actually, so that was nice. So here's some pictures of events that we do. I know we have, residency retreat every year, so I'm looking forward to that. We had a ping pong tournament actually too, like on 4th of July. So that was nice. Got second place, a little disappointing, but that was fun.
Yeah, tough competition. Yeah, they were
tough
pretty
competition. Tough competition. But yeah, we're going out to eat all the time. I feel like the residency class is pretty tight knit already, so it's pretty nice. But yeah, wellness is obviously super important something that Burke takes pretty seriously, which I appreciate, and I think most of us appreciate. And obviously, going to in med school or in residency, you always have these mandatory wellness events that don't feel like wellness sometimes. But I could say that so far our events are actually fun to go to, so it's nice. Next slide. I think Anju's taking over from here.
Hi, everybody. I'm Anju. Nice to meet you all. Thank you all so much for coming out. This slide is just about like our leadership. As Dr. Chaudhary introduced himself, he is our program director. Dr. Shah is our associate PD alongside Dr. Abdu. Dr. Park is our CMO, and Dr. Travato is our associate CMO. Dr. Travato and Dr. Bushy are actually both on the TBI unit alongside Dr. Guman. Dr. Mucha and Dr. Mary that you see on the bottom are both part of our stroke unit, and then Dr. Sai and Dr. Vallis are both part of our spinal cord injury unit. And they are all, this is like such a great team of attendings to have in your corner because they're all so helpful. Like I've been here for a month and everybody has reached out, everybody has helped me out. Dr. Travato is my mentor and she's already had a meeting with me and kind of focusing on future academic goals and like career goals. I was on call yesterday and Dr. Abdu called me just to check in and see how his patients were doing. So everyone's really looking out for you and helping you out.
Yeah, I guess from my end too, like, I'm in my last year. Everyone's like relatively young, but also experienced. I think that's a good combination for kind of most of our faculty here. And they're very helpful, whether it be like in residency or early career, I think, which is very nice to have that perspective.
This is our current group of fellows and residents. Obviously, the PGY2s are the best class and the most coordinated. Look at our wonderful photo on the bottom left. We are an advanced program, so these are the PGY2s, PGY3s, and PGY4s on the bottom row. We started off with 4 people per class and then increased to 6 people per class. And during my year, we increased to 8 residents per class. I believe going forward, we're continuing the 8 residents per class. We do have a sports medicine fellowship who's pictured on the top left, and then the brain injury fellowship who's pictured on the top right, and that's Dr. Travato in the middle. These are our rotation sites. So we do rotate at all 6 of these locations. Of course, we're going to be at the Burke main campus, which is where we do all of our inpatient rotations and a bunch of our outpatient rotations. The White Plains Hospital, we go there for interventional pain and sports medicine. ONS Sports, of course, sports, Montefiore Hospital. We do have some outpatient rotations there and some pain rotations. Jacobi Medical Center is mostly for consults, and then Seton Children's is for our pediatrics rotations. And I will hand it off to Ricky.
Yeah, so moving on to rotation schedule and call. So Burke is kind of unique that we have like PM&R and medicine NPs that kind of help cover the floor. On call, especially, there'll be like medicine NPs kind of always covering. So they'll help you like with anything that acute that comes up, or sometimes when we're kind of transitioning to this model, like we will kind of tag team like can you do this admission? I'll do the other one, and we'll kind of work together to make sure like everyone's taken care of. So I think that camaraderie amongst like different level providers is always kind of nice to have too within our training. During my time, we used to be 24-hour call, but we are transitioning to pretty much no 24 hours. Here and there, we might have like coverage stuff, but it's very sparse, the amount of 24-hour calls we have. The goal is none, but obviously even our NP colleagues, they're like 7 on 7 off. So here and there, we'll definitely kind of have to help cover. The on-call shift is kind of complicated, but like overall, it's like 5 to 7, but then the weekends and Friday through Sunday is kind of mixed. It's like you start your call shift, but then the time you end may kind of vary depending on admission count and et cetera. When you are on call, we have a pretty large on-call room. It's in like the hospital basement. There's like a bed. This TV works. I think they got rid of this fridge because no one used it, and like I think someone accidentally left food in there. There's a Keurig machine, which I don't think anyone touches this because we get free coffee and food in the cafeteria, so no one actually used this machine. But there's a computer here, very large private bathroom here too, so very comfortable if you are on call. It's kind of structured in this bottom table, like as most residency programs, when you start, you'll kind of have more inpatient months and more call, but then as you progress through your residency, you'll have less inpatient, more outpatient, and like less call, and your PGY4, you're pretty much no call, which is very nice. Moving on to didactics, which
he's rubbing it in. He's rubbing in the no call.
Yeah, we just transitioned. It's interesting. It's nice, you know, everyone goes through it. Moving on to didactics. So it's every Wednesday, 8 to 11:30 a.m. We're on an 18-month curriculum. It's something that we started this year with Dr. Chowdhury. Um, so hopefully we have like more time with each topic, and that way it's kind of cemented a little better. In addition to that, we're structuring like monthly ultrasound workshops, EMG workshops, QI and PI workshop. Additionally, we're trying to involve like a monthly like patient panel. Recently, we had like a SCI patient panel, which was very like eye-opening. It definitely gives you a perspective on like why we do the things that we do, and we get to ask questions to the patients. That was very rewarding. These didactics, we try to vary the rehab lectures, whether it be from attendings, guest lecturers, fellows, therapists, and try to get some industry people to come and so we can play around with some like fun tools like this VR injection thing. I think this is Dysport down here, which is always nice. We're also doing like oral board prep with the attendings who are very involved with their education. They'll do cases with us and kind of prepare us for oral boards. Lastly, the Cadaver Anatomy Lab. We're associated with Montefiore and also Einstein School of Medicine. So we have anatomy lab later on in the year where we go to Einstein and then get a little lecture and, you know, do the anatomy workshops. So some of the opportunities that we have at Burke, I think we have quite a bit. You know, obviously the first one, rotations and observership for med students. Right now, unfortunately, we're kind of on pause because we're trying to set up like an official rotation with the Einstein School of Medicine. So, you know, once that kind of gets cemented, I think our goal is next year to kind of open up back to med students rotating with us. Andrew kind of touched on this, the resident and attending mentoring. So we, you know, pair each resident with an attending, but also I think this year we split into groups so that there's like peer resident mentoring, which I think is very helpful once we like, you know, each level that we progress, there's discussions that we have that's easy to do with like your colleagues. So AAP has like a medical student summer clinical externship that's available, and Burke is one of the sites that sponsors med students to rotate through. We've had, but during my time, we've had 2 med students rotate through. They had 8 weeks here and like had case reports they presented during AAP and stuff, which was very nice to have. We also have an annual medical student fair that a couple of my colleagues are planning right now. So whenever we do that, we'll probably post on our Instagram. So, you know, if you guys are in the area, feel free to sign up and come and see, you know, what Burke's all about. Research and leadership. Obviously, there's plenty of leadership opportunities available, whether it be through GMEC and PEC, which is like Graduate Medical Education Committee, or the Program Eval Committee. We have an annual Burke QI conference where we, you know, figure out issues or things that we can optimize within the hospital system so we can, you know, present it during a hospital-wide event. So there's like nurses, therapists, residents, fellows, we're all presenting like things that we could improve, whether it be like rapid response or testing certain things or just trying to make the hospital a better system. Sports coverage is something else that's open and available to us. We're actually going to have like a sports coverage workshop with the Burke Sports Fellows and some of the sports fellows from Montefiore. Adaptive sports is another huge thing with Burke. It's kind of led by our therapy staff. They have adaptive cycling, adaptive golf, adaptive boating, sailing, hiking. You know, whenever you have time and you're interested, you're always more than happy or more than open to these opportunities. And then there's another picture down here with the New York Marathon coverage as well. We also have opportunities to rotate through Hanger Clinic to see the whole process for like prosthetics and orthotics. And teaching, you know, we'll assign lectures to residents. There's ultrasound and EMG workshops, whether during didactics or outside of didactics. So this is the page on alumni. Obviously, like Isaac touched on, we're a relatively young program, but I think, you know, it speaks volumes about like where we meshed and, you know, where people wanted to go. I think, people are always curious, like, how does people match? Obviously, in my class, there's 2 matches already. The other 3 are kind of to be determined, and then 1, I think, is going general. So we'll see what happens at the end of the year. Talking about benefits, I think Burke offers a pretty competitive salary for, especially in White Plains. The salaries, I think, just increased this past year. So I think overall, everyone seems pretty happy. There's obviously health and dental insurance. The program offers membership to, or provides membership to AP and APM&R. The subscriptions for APM&R and PM&R Recap are paid for as well. With our partnership through Montefiore, we also get like emails about free tickets to the Yankees or NYCFC games. There's 4 weeks of vacation annually. One of my main priorities when I was looking for a residency program was free meals. So there's free meals on and off campus. So if you're rotating at like Monty outpatient, there's still $20 that you get reimbursed, which is nice.
5 minutes remaining.
Okay. Conference fund, $1,500 annually. Annual education stipend. We get a bunch of books on our first day. And there's also on-site housing available, which I think Isaac will be able to answer any questions on. And lastly, this is our contact for our Instagram. I think we try to be as active as we can, so please follow and you can see what we're all about. Our program coordinator, Maddie, I forgot to put our email, but I can send it out to you guys. And here's our emails. If you guys have any questions later, feel free to reach out. I think most of us are pretty open to answering any questions. All right, so let's see. I think there's some questions in the chat. All right, so the first one, what are some differences between patient population and flow, different rotation sites? Oh, so yeah, that's a good question. So I think it's nice that we rotate through Montefiore and also Jacoby, just because Burke is located in Westchester and White Plains, so the patient population's very different, whether it be like their socioeconomic status or kind of their accessibility to resources. So I think it provides us a pretty good breadth of different patients.
Yeah, I'll add, you also get different healthcare settings. You get a city hospital, a private hospital, a public hospital, an academic sort of setting. So you get good exposure in different settings for when you're out in the real world.
Let's see, does everyone get a chance to rotate with Monty? Yes. And vice versa? Yes. Yeah, our Montefiore colleagues get to rotate with us on our inpatient, and then we rotate with them on their outpatient and the consult service. What's the relationship like? I think it's pretty good. Like the Chiefs currently at Burke and the Monty Chiefs, we're all very like cool with each other. Pretty much every class, we all kind of hang out with each other. It doesn't really matter like what level you are, which is nice. Let's see. Seton was listed for Pete.
Yeah, I can answer. So about the Seton Children's and Blythedale. So Blythedale is close to Burke, but it's part of Columbia's rotations. However, as an elective, it wouldn't be difficult to rotate over there. It was just a matter of filling out the forms, basically.
2 minutes remaining.
Let's see, free meals, food scene in White Plains. Surprisingly, every time I go out with people, so I live in the city, but then whenever I go out with my colleagues in White Plains, the food has been pretty good. If Anju and Isaac want to comment on that.
Yeah, kind of just mentioned in the chat, but food's been good. Food's been good. Yeah, kind of pleasantly surprised coming from did my TY year down in Miami. So obviously coming from a good food city and coming up here, I was like, okay, bars set pretty high. But it's been good. And then obviously you have New York super close by and you can't, second to none. So
yeah, I guess the time is running low. I can answer questions in the chat still if you guys put them in. The main question people are asking is, I think, what would make a successful resident at Burke? Ricky, if you want to talk about that a bit.
Yeah, I think I always kind of say this to everyone, like any med student I mentor. I think being a good resident is like relatively easy. You just, like work well with each other, show up on time, get your work done. If you do those things, I think like overall your life just gets much easier. I think at Burke, it's nice that we're very well supported here. I keep mentioning that our attendings are supported, but they're close in age and close in, obviously they've been through our journey, so they're very understanding and supportive on like pretty much anything we want to do.
Yeah, I would add, so like as someone that's very like self-motivated, has strong goals, you'll get a lot of support to work towards those. So Burke helps you achieve many of the things that you might be seeking. And then we'll answer the rest of the sort of ones in the chat about like transport and food and stuff like that, I guess.